So, thank you so much, everyone, for joining us. It's so good to see you all. Welcome to today's Berkeley Pharmatech Foundation Speaker Series session. I'm Himani, and I'm a volunteer with the foundation. The Berkeley Pharmatech Foundation is dedicated to increasing access for scientists and entrepreneurs in biotech through education, mentorship, and professional opportunities. Through this speaker series, we bring together industry leaders to share insights on biotech, innovation, entrepreneurship, and career development. Please follow us on LinkedIn and Instagram for update and feel free to reach out to Van Loen, our founder, to explore more ways to get involved with the foundation. A quick note on the format, we will run first the talk track and then open it up for live Q&A towards the end. You can drop your questions in the chat as we go or raise your hand to ask live and I'll bring them in. AI budgets are growing across every industry, including biotech, but so are failed pilots and stalled projects that never make it past a demo. Today's session is all about the exact gap, how organizations actually move from AI experimentation to something that creates real, measurable business values without losing the human judgment that makes any of it trustworthy. Our speaker today is Sue. Sue is a fractional chief product officer, AI product strategist, and managing partner at Intellectus Advisors, where she partners with Seed through Series B companies to move from AI experimentation to structured adoption, covering product strategy, governance, and go to market execution. She brings nearly 2 decades of experience building and scaling SaaS and AI native products and has worked across the full arc from early product concept to make market adoption. She's the creator of HITL, that is Human in the Loop Maturity Model, and Human Pulse, a framework for measuring and improving the quality of human oversight in AI systems. Her core belief is that trust in AI is not automatic. It's something you have to design, measure, and maintain. Today, she will share practical strategies for evaluating AI opportunities, building AI enabled products responsibly, and designing systems that keep humans meaningfully involved in decision making, drawing on lessons from both AI, native startups, and established companies. Please join me in welcoming Sue.
Thank you, Himani. Wow, that was quite an introduction. I want to start with one of the recent kind of stories that I was following. It's about Epic, and everybody who's in healthcare and pharma has probably heard about the Epic system, which is the electronic health records. So Epic runs on most US hospitals. It was deployed at hundreds of them, and they built a new AI prediction software called Sepsis. It's sepsis, Epic Sepsis was meant to detect sepsis, which, as you know, is a serious infection. And if you catch it early, you can save lives. Epic reported performance puts its AUC, which is like a threshold that they measure for is it acceptable in clinical workflows or no, between a good 0.7 to 0.8, which is a big thumbs up, which says, yes, you can take it to market. But then a couple years later, University of Michigan, I believe, ran an independent study. And they found that the numbers that were reported were grossly overstated. And they immediately put a stop to it. And they said, no, this does not qualify. There are a lot of failures in this AI solution. So in this whole talk, we are going to talk about what happened there, because Epic is a large organization. They ran all the tests. They did the pilots the way they were supposed to do, but it still did not meet standards when it hit production. What investigators actually found was the actual AI model used antibiotic orders as one of its inputs. Doctors order antibiotics when sepsis is already a suspicion. So the model was partly detecting the physician's own judgment and then reporting back as prediction. It looked very smart as long as there was a human in the loop, which is the doctor. But the minute that was removed, the diagnosis was completely wrong. So there was a huge gap between reported numbers and the real one where AI alone could perform. So today I'll walk you guys through what happens when pilots don't deliver and why don't they deliver in regulated environments. I'll also share a maturity model that I've developed. I've been doing research where, as of now, I've ran this framework across 40 plus AI workflows in real environments, and I'll share some benchmark numbers from that. I think Himani spoke enough about me. Just one thing that I want to add is that I've spent a lot of time on AI, on building products. And the last few years, I have particularly focused on where do humans belong in the AI and human journey, and what happens when something doesn't go right. That's going to be our whole conversation. So before the mechanics of, going from pilot to production, let me talk about one thing that people often miss, which is when should you even adopt AI? When is an AI opportunity good? And it cannot just be that we've gotten approval to use a model, so let's use it. There needs to be more. And one of the first things I want you guys to focus on is how valuable is using AI in your existing workflows. Can you justify it? Can it tolerate a human checkpoint? Does it slow things down for you, or does it truly add value? Now, let's talk about once you've gone through this assessment and chosen the right projects to introduce AI, you would always want to start with a pilot, because a pilot is a controlled experiment. And that's kind of how most regulated industries introduce new technology. But a pilot is so controlled that you don't know that it is controlled. There is always a human that is deeply involved in pilots because they're curious, because they're excited, but they also want to make sure that this adoption is successful. Going back to Ida, you were mentioning that you're excited about, bringing in Claude Core and Claude Cowork. You are that human in the loop who wants AI to be successful. And so when you introduce pilots, you have folks like this who are invested in its success. So let's talk about, 4 conditions that hold true during development that will quietly disappear at production. The first one is curated inputs. Development data for pilots is usually clean, and it's representative of the happy path. Production, whereas, is messy, and it's never predictable. So pilots are predictable. You have a smaller project and you're giving clean data, whereas production is not the same. The second is the invisibly embedded human, right? In the antibiotic story, there was always a human or a doctor inside the model's inputs, and their judgment was being considered. But when it took off to production, they had seen that the AI performed so well that they forgot to add the right humans in the loop there. The third one is favorable measurement. When pilots are measured, you're only measuring what the AI did. No, you're actually measuring what both the human and AI did, but then you're calling the success of the pilot as the AI's success, right? I have never heard anybody say the pilot was a success because the team made it successful. They think they're only evaluating the tool, but you are evaluating how well the tool fits into your team, and no one measured it. right? No one measured the collaboration between the team and the tool. The fourth one with pilots is no consequences yet, right? In development, an error is just finding. In pilots, it's just a finding. They're like, oh, gotcha, AI's recommendation here wasn't great, but I'm going to teach it how to do it. And the next recommendation is better. That's how you're behaving when it is a pilot. But in production, if you miss a case, that can be catastrophic, right? For example, in the sepsis example, if you missed a sepsis diagnosis at the right time, then that is a huge deal. So these four things that we believe where pilots and production are alike is actually the first four things that we trip on. So curated inputs, embedded humans, favorable measurement, and no serious consequences, right? So it's like it's a sandbox environment. So what I noticed with this is one of the benchmark numbers. It's like all of the tests that I've been running, the research I've been doing. If I ask people, is there a human in your loop? The question is always yes. And it's because it's a binary answer. It's either there is someone watching over your AI pilots or they are not. But what's more important is the follow-up question, which is how empowered is this person to make changes once AI finds something faulty in its output? Are you enabling them to give you that kind of feedback? Do they have the permissions to overwrite what AI did? And in most cases, the answer is no. There is an illusion of oversight, but then there isn't real oversight that's being measured. So I have a quick ask for all of you, and we'll revisit this a couple slides down. If you are using an AI tool at work or you're intending to use, do you know who reviews the output? I want you to put their name in, not the role. You don't have to put their full name, but just their first name. So if you're using AI tools, who reviews the output and ensures that it's accurate? And can you even name that person? Drop it into the chat if you can name them, or if not, just a yes or no is also acceptable. Let me know, Himani, if there's... Okay, Ida, that's great. Abhi has someone named Stu, that's great. Monica, you say yes. That's fantastic. This is the first thing you need to be thinking about. First, making sure you have a human in the loop, and two, being able to name them. And it's more than just knowing who the fall guy is. It's to understand who's accountable when AI goes wrong, right? You can't just say AI did it and hide behind that. You need an accountable human in the loop who is going to assess and make sure that the AI or your pilot is going well. So let's move on to what are some of the collapses that I've seen. And this is again coming from the examples of my own work, where I see how these kind of work out. So if I talk about, I'm using the first story of the sepsis, epic sepsis, because it helps us kind of, see how each of those work. Every out of the 40 plus I've seen, almost every single pilot has failed because of these four reasons, and in that order as well, right? The first one is the accuracy collapse. The moment the model ran where the embedded human judgment wasn't already present, the real error rate started to surface, right? With the sepsis case, the numbers dropped significantly when there was no human involved. The model did not degrade, right? The first reaction I've seen people say is, these are folks who are trying to educate themselves about frontier models, about model accuracy, about domain-specific models. So it's very easy for them to say, you know what, the model accuracy for, say, Claude or OpenAI has dropped. which is why there is such a big change in our accuracy. Though accuracy is a function of the frontier model, accuracy collapse happens because the human judgment in that step was lacking. So when the unaccounted human who was behind the scenes fixing your AI's outputs or training them is not there anymore, or they're not able to handle production level traffic, the accuracy will drop. It's not just the model that is at fault here. If anything, the accuracy of all the frontier models has gone up in the recent times. And there isn't one better than the other, in my opinion. They're constantly getting better and they're all benchmarking around the same. The second one is a capacity collapse. Say the model fired alerts on 18% of hospitalized patients. Someone has to look at each one of those. When the model escalates, say you've built a workflow where you're saying, if this model is not sure of the answer, escalate it to the human in the loop. Say Abhi said stew, so stew, escalate it to stew. How many more stews do we need if the percentage of escalations go up? And how are you able to predict that at production grade, right? How are you able to understand that? So capacity collapse happens. At production, the volume is high and there's a flood, and the human who's meant to review becomes a bottleneck because nobody really staffed for that role. And there's also a degradation in how a human performs. This was another benchmark number that those 40 odd experiments revealed, is that in the beginning, everybody is super alert because the human in that loop is invested and wants to give feedback to the AI. But 1 month later, they were so confident because the output was always nearly accurate that they stopped reviewing it. And that degradation goes unnoticed because no one's really measuring their performance. They're all focused on AI, that they're not looking at, hey, did you wake up this morning and actually read the 10 escalations? Or did you just say select all and approve? Because now the AI is won over your confidence, right? So what's important to avoid capacity collapse is to ensure that you measure the human and AI performance collaboratively, and particularly make sure that as production volumes go up, you are staffing people accordingly. This is sort of the opposite of what everyone says AI is doing, right? Which is replacing humans. I actually think what it's helping with is understanding where the right amount of humans need to be and who they have to be. And so capacity collapse is one. The next one is trust collapse. So say clinicians who are drowning in false alerts learn to ignore the tool. And that's alert fatigue. And that can be fatal, right? Because one real alert arrives amidst 20 fake ones or 100 fake ones. Do you still think that that person's invested enough to look at that 100 and catch it, right? The tool added so much noise instead of removing it. So what that led to was people turned it off. They said, well, AI adoption failed for us because there were so many false positives. And we were not able to get that. So the way I think about it is AI systems rarely die loudly, right? They don't blow up like they show in cartoons and things like that. They quietly fail, and then the consequences are very serious. That's because no one's monitoring them closely, or they weren't designing with AI and human and their business requirements all together right from the beginning. So as trust collapses, like in healthcare and pharma, there isn't a lot of room for error. So if the person who's using it, the clinician who's supposed to review, say, 20 reports and sign off on it, fails to do one of it, that person, it might cost them their jobs or it can cost the company the AI tool and efficiency that it could have bought. So trust collapse is another one I've seen. The last one, and this one was big, was evidence collapse, right? The Epic sepsis model shipped to hundreds of hospitals for years before anyone published an independent validation. And why was that? Because we believe that the controlled experiments they ran was enough. So when University of Michigan finally did it, and the gap reported was really enormous, no hospital had record to have caught it on their own data at all, right? And which was very telling, because a model that was sitting there and doing that job was scoring its own success, was scoring itself. So all of the dashboards that hospitals had up was checking for AI model accuracy, and they had set up the model to monitor itself. And so they had all missed it. And so how did Epic get out of this? And what they said was, well, we gave you the base model. Now it's up to you guys to train your own specific hospital models for you to meet your own needs. That's the domain specific training that nowadays people are talking about, where they say use your own proprietary data to train the frontier models so that they better understand your business case. This can come in the shape of context files or skills, or if you're using Claude, but it's training the frontier data on your own. But what Epic did there was really retrofitting validation after the fact, after it was built. But if you are starting off doing this for the first time, I would incorporate this right in the design stage, so that there's no evidence collapse and you're collecting and training everything you learn from your business. You're training your own models on that. So for those of you who are founders or investors here, evidence collapse is like a valuation event. So when a partner or an acquirer, or if you want an FDA approval, they examine your AI pipeline and they find outputs with no independent validation, no review record, that's a diligence finding. So you have a governance debt that's compounding if you don't have evidence that an auditor can come and look at. And what I mean by evidence is there are few dimensions, and we'll go into it. For each of those dimensions, your AI should be performing well, and you should have enough proof in each of those steps that you are meeting those dimension requirements. And we'll talk a little bit more about that. Okay. So everything I've described is a human oversight problem, right? So here's kind of the instrument that I use to measure it. And I will be sharing with you all like a worksheet and also a skills file if you're actively using AI tools like Claude or OpenAI ChatGPT. You should be able to just import the skills file and do your own assessment on your own tools. I'll share that at the end. But essentially, this is what it has. So I built the HITL, which is Human in the Loop Health Index, while I was working with AI native startups. So 6 dimensions, and it's very deliberate. It's simple enough to run. And I'm going to use the sepsis example through all 6 to kind of talk through it with you. The first dimension where you're measuring, sorry,
sorry for interrupting. Are you sharing your screen? I'm not sure.
I did not stop sharing my screen.
Okay, if everyone can see that screen. Okay.
Okay.
Sorry for interrupting.
No worries, no worries.
Okay, thank you.
Okay, so the first dimension is intervention quality. So what you should be looking for there is anyone checking the output, and are they good at it? In the sepsis case, the only human judgment in the system was a clinician suspicion, which was baked into inputs. Nobody was independently checking the model's prediction. So intervention quality was effectively 0 for them. And the reported score of their overall performance hit that. So the way I've come up with these 6 dimensions is to peel that onion layer of what an AI efficiency and AI accuracy looks like. And then I've bundled it into these 6 dimensions. So the first one is intervention quality. The second one is feedback loop integrity. You have a human in the loop, fantastic. They're using it actively and teaching your AI model how your business works, even better. You have domain experts, even better. But what is feedback loop integrity? When a human catches something the model got wrong, does that flow back in? If nothing flows back in and it's just in their email where they're, venting out to you about how bad AI was, that's not enough. You need a feedback loop that feeds back to your model. It cannot be in journals, it cannot be in log files that nobody checks. So you need to design a system where people that are actively using your AI solutions have an easy way to provide their feedback back to the base model. In large enterprises, they have an entire team doing that. Whereas in smaller teams, they take all of the feedback in a log format and use it to train their base model. So they're essentially teaching it right there where they say, hey, this is everything we've collected. These are the things we want you to learn. I use AI more as an individual as well. And I'm constantly telling it, here's more context about my work. Here's more context about how I see. So feedback model integrity is collecting feedback, making it easy for them to report that feedback out to you. Say someone on your team catches model inaccuracy. If they have to go fill a huge form, get in front of a disciplinary committee, and then prove that they found issues, they're never going to do it. You have to make it easy for them to provide that feedback to the model, right? So that's the second dimension. The third one, we've touched upon this a little bit, which is human capacity health. Are the reviewers staffed for real volume? The model fired 18%, and then nobody really was resourced to receive it when it went up to 70 in production. So measure the capacity health before it fails. And the way this is all kind of interlinked, right? If they're overwhelmed, then their feedback loop integrity also drops because they've stopped giving feedback. They've stopped caring about small issues as they think, which can then build up. So have a human capacity health check. The fourth one is trust calibration. Do people in your organization really trust AI? Or how does it earn that trust, right? Because alert fatigue is a miscalibrated trust. Clinicians learned that the tool cried wolf. They're like, I went to medical school to do this. This thing is just crying wolf. Let's not trust its output. So trust in AI output comes from the people that are using it. So if they look at it as a competitor, if they look at it as something that is pushing them to make better decisions, then depending on who's using it, I've seen people say, I know better than what it's saying. But if you put them in charge of teaching AI and make this a collaborative step and say, hey, the tool can only get better when you teach it to be better. I've seen people interact with it a lot more, and the trust calibration increases. I don't have it in this deck, but I've been spending time thinking about how do you measure trust, right? Because trust has to be more than just a feeling, especially when it comes to AI. And how do you measure it? And I'd come up with a simple equation, which was trust is accuracy of the model times transparency, which is where it's telling you how it's thinking, what decisions and inputs went into the AI recommendation, and the human or the user can actually see it, times accountability, helping people understand that, hey, listen, there was an actual clinician reviewing this record, or we have an expert, a domain expert who's training the model. So it's accuracy times transparency times accountability. And all of that, all of those three things will help with increasing trust. And all of those three things are possible when you have a meaningful human in the loop. The next dimension is governance compliance. This is the one that catches everyone off guard, and it's my benchmark finding that 70% of the companies I assess score really well here, because governance is such a serious issue in regulated industries that they're focusing on policies, sign-offs, procurement reviews. They've passed compliance. But the thing that they overlook when it comes to governance compliance is the human oversight. How are folks who you've introduced this AI tool to, how are they performing? Has their performance gone up or has that dropped? And how is that trust between your team and the tool? And are you measuring for it? So governance traditionally meant security, policy, approvals, all of that. But when it comes to AI, you have to be looking at governance as a holistic score for both people involved. The last dimension, and this became more relevant once agents became the thing in 2025 and 2026, which is agentic readiness. Could this oversight survive giving AI more autonomy? It sounds like a scary thing if everything else above this was not done right. So if you can't independently verify a single source prediction like this one, can you imagine setting up a multi-agent system that by the time it even reaches the human, it's touched 20 agents, 300 processes, and God knows how many customers, right? So for agentic readiness, you need a mature system. You need the right humans in the loop. But what I'm also seeing is that you have monitoring agents. So you have these management agents who manage 10, 15 agents themselves, and the human is responsible for that one management agent's performance. So they're not looking at 30 agents that are wired together. They're just looking at one management agent, almost like a supervisor. So that's another dimension that the HITL scores measure. Did you notice what happened when I ran those 6? Like 5 of them were failing, and the one that passed, which was governance compliance, was the one that everybody measures, and they leave out the others. And this is again what I call the oversight illusion, right? People think they have oversight, they have governance, but then they're missing what can literally define the success of your pilot and can make this work in production. So I've kind of boiled down this thing to a 5-minute version. I have a framework, I have a free tool, happy to share that with you guys later, that does this, where you self-assess. But then the 5-minute version of that are the 3 questions you see to the right. In question 1, I want you to name the actual human. And if you can't, intervention quality is fictional. So remember the question 1, you need to have an actual name. Question 2 is intervention rate. If nobody knows how often the human steps in, you don't know what your AI does. And you know what your AI plus an unaccounted human does? I would highly doubt that, right? So I want you to be able to answer question 2 with an intervention rate. And question 3, 10x an audit. If honest answers are no, you have a pilot. Whether the status report says it or no, you still just have a pilot and it's not ready for production. So go ahead, screenshot this, run it across your AI work that you're doing tomorrow morning, and just do a quick check to see if you're meeting all of these dimensions. And if you and your team are able to honestly respond to these questions, and you feel confident about the answers that you're discussing aloud. So let me close where I started. So the doctors whose judgment was baked in the sepsis model, they were never the problem. They were the design and nobody spoke about it. Nobody identified them as part of your AI workflow design. And which is why I think, right from the beginning, when you're designing an AI system, it's very important that you design it right. It's a discipline that often gets overlooked, and it takes all those dimensions into account, and it tells you how to work with a human, where to put them, what to measure, how to measure AI outputs, and then how to measure their collaborative outputs as success. I want to take a pause before, I kind of speak more about this and leave you with, which human is catching it, and did we budget for them, and all of those fun things that I get asked by founders. Is this an additional hire? Is something that I get asked all the time. So before we go there, I wanted to open up for questions. And I'm happy to share the resources I spoke of with Himani, and hopefully it'll reach all of you all. And if you want to, I do this with corporate teams, small and large, where I come and do a workshop and teach your teams how to think about human in the loop design. What are even the terms to know when you're talking about human in the loop design? What is oversight? What is human in the loop design? If you're interested, get in touch with me. I'd love to see what you all are working on. But let's take a pause for questions.
Please feel free to raise your hand or just send your question in the chat. While we are waiting for the questions, I have a quick question. So if that's okay. Uh,
Yeah, please.
you have worked with both AI native startups and established company. What is the common mistake you see when a pilot goes well?
When a pilot goes well, I see that they've been designed well with a clear understanding of where the domain experts had to be,
Mhm.
and a clear understanding of where it actually adds value and speed things up, and where they become road bumps, right? Like, you don't want the humans to become bottlenecks in this process. So how do you effectively design that?
Mhm.
But I think one of the other common things I see, Himani, is that oversight illusion. Like I said, the question has a binary answer. Do you have a human in the loop? Everybody, especially now, being human has become cool again.
Mhm.
So everybody's answer would be, yeah, of course, we have a human in the loop. But it's the follow-up questions that really defines if the pilot can turn into production or not.
Yeah, thank you. Thank you for answering it. Uh,
Yeah.
does anyone have a questions? Because I do have a like this was a very interesting session, so I do have some questions, but I wanted to like give a break, and like if anyone wants to, please feel free to raise your hand or type your
Is
question.
there something in the chat? Wonder if the
We don't have a question, but during the meeting earlier, Jyoti just have asked a comment. In the absence of an AI tool, the entire capacity is handled by humans. This is definitely productivity enhancement, right?
There is definitely productivity enhancement. Jyoti, would you like to come off mute and talk, or happy to just address that question?
No, when I typed that question, hi Sue, thank you so
Ah,
much. This was a wonderful session.
I'm
And when
glad.
I typed that question, that was the first thing that came to my mind. But then I think in the course of the talk, you did answer this already. So I'm fine.
Okay.
Thank you.
Okay, great. Thanks, Jyoti.
I do, however, have another question. When you talk about alert fatigue, um, how do you enable
Hmm.
false alerts versus mixed ones versus authentic ones? Is there a system that you can build to make sure, people rely on AI and people develop trust over a period of time?
Yes. Absolutely. So it again is a part of your design, right? And the way I've seen it happen, and even when I work with my clients, what we do is we spend a lot of time on confidence routing. Confidence routing is where you understand what your business is, you understand the kind of ways your user interacts with your business. And then based on a certain criteria, you start assigning confidence to AI outputs. So for example, in say a customer support example, if the answer is in your FAQs, if it's something that is, a simple query, then the confidence for AI is high. And so it'll route directly to the AI. So if it's something like, um, I worked with an airline company and the question was, what is the amount of baggage allowed? And that's something that's available in their FAQ. So it automatically routes to AI. Now, if the query is such that there is some amount of ambiguity, if someone says, I wanted to change my flights from Boston to Dallas, but I'm unable to do that, so I want a refund. There is ambiguity there because it's not straightforward. In those cases, AI decides, it looks at the company policy and decides, but then it needs to be reviewed by a human. So for that, we would set the confidence rate as AI's confidence is 85 and below. So a human has to review. So the AI model itself starts to understand that these are the type of answers that I can respond to. These are the type of answers I need a reviewer. And if there are ones that the AI absolutely cannot address. For example, there was some emotion involved. When we worked on this use case, AI still wasn't great at picking up emotional cues. So someone said, because of your policy, I missed my flight. I could not see the birth of my child. I'm having a nervous breakdown. This does not go to the AI at all. These kind of queries go straight to the human to have the conversation and resolve. So yes, to increase or to improve that rate, Jyoti, you would have to build a good confidence threshold planning for your system such that the false alerts reduce. That's what we've seen. That's what I've seen work.
I do have a follow-up question, but I think
Yeah.
I'll wait to ask because I think there are other questions. I think Abhi has a question. I'll
Oh,
ask after, I'll come after Abhi.
okay.
Okay.
Thank you, Jyoti. Yeah, I can read that question. Thank you, Abhi, for the question. Thank you, Sue. Very useful information, something for introspection, and certainly deserves including. How to plan for 10x volumes, resource support, as they may be very periodic and not always 10x. What else that person do when volumes are
Hmm.
low? Trying to understand how to design this role when the volumes are always fluctuating from 1x to 10x.
Well, fantastic question, Abhi. And from the looks of it, it tells me that you're probably in some kind of a program leadership role because you're thinking about the right questions. The way I've advised companies to do this is to not add additional headcount because you have those people right there. So when I say use a domain expert, I'm talking about, say, in this customer support example, you have existing customer support representatives, and what AI helps do is free them up of all of the queries that are very easy to answer that the bot can handle and reserve them for the highly important business critical kind of cases, right? So it's optimizing the human to do better as well. But how do you plan for it when it goes from 1x to 10x is a fantastic question because the industry is changing where before we used to have singular experts. So if you hired someone to monitor just the AI outputs who has a domain expertise, say a business analyst, and they're doing just that. But now if AI handles a lot of it when the traffic is low, I've seen them getting pulled into other roles. So a lot of people who are doing domain specific individual roles are now merging to more generalists where they're able to handle other things and handle more. Um, but I don't think I have seen a case where they had to hire extra people just to monitor AI. They were able to repurpose and train existing resources to take this on. And you would be surprised how willing and excited they were, because at some point, I think people did want to stop doing repetitive jobs themselves and take on something more exciting. So this gives them that opportunity to do that.
That's really good, Sue. Thank you. I think you ticked all the boxes. No impact on budget, optimizing existing team. There's a learning path there for everyone. And I'm guessing there's better AI now because it's better MI now because of AI.
Yeah.
So, no, that's good. Thank you. I think that checks all my boxes. Thank you for that.
Thank you for that question. But you've also given me something to think about. I want to now go research how big companies are doing this, because we don't want what happened, during the COVID wave, where all the big companies like FANG companies hired a lot of people, and then in the past 2 years they've let go half of them because the volumes dropped, right? So we'll see what the industry takes, how this industry takes shape. But thank you for that question. It's got me
Thank,
thinking.
th- Thank you, Sue.
Yeah. Unfortunately, Jyoti has to leave early, so
Okay.
yeah.
Maybe she can send you the question later or connect with me later.
Mhm. Yeah.
Oh, that reminds me, I just wanted to drop my LinkedIn here. If you guys aren't connected and you want to further the conversation, then reach out to me on LinkedIn.
Yeah. Is there any other question? I think while we wait for the question, I can go for a quick question I have.
Yeah,
So,
please. Yeah,
okay. Uh,
absolutely.
for the students and early career researchers here like us, what should they learn now to build AI responsibly?
Yeah, I mean, that's I would say start with understanding what human in the loop design is, understanding what responsibly adopting AI is. And I will obviously share the resources that I have as well.
Mhm.
The best way to learn is to get your hands dirty and start building something small before you have to do it at work or before you're forced to do it at work. The industry is moving in that direction. So I would encourage you to create your own small projects. There's a lot of tools out there that's enabling you to do them. Educate yourselves on how to build them, educate yourselves on what a governed AI solution looks like. I earlier said I will share with you guys a skills file. A skills.md is more applicable to a Claude user, where it's like your context file. It literally sits in your Claude's brain, and every time you're running your project, it remembers that. So, what I would say is start building, start understanding what needs to go into these kind of context files, which stays true regardless of any project you're working. Like,
Mhm.
one of the other things, other than obviously governance, the one of the other things is, you've been hearing about AI slop, right? Everybody says, oh, this was AI slop, that was written using AI, etc. um, you can create skills which speaks in your kind of tone, and that removes AI slop and things like that.
Mhm.
That's a long-winded way of saying get building, get your hands dirty. No matter how much you read and study about it, it's still worthwhile to build your first agent, to build your first multi-agent, and there are a lot of tools for it out there.
Okay. Thank you. Thank you.
Thanks, Himani.
Mhm.
All
Uh,
right.
yeah. Does anyone have any question? But we do have a lot of comments saying the session was so helpful. The idea of a person in the loop is very comforting. So, yeah.
Absolutely. Absolutely. Thank you for being here. I really appreciate you guys joining. There was Ida from Germany and Abhi. I know you're in Europe as well, and both coasts of the US. So thank you all for joining. I hope this was useful. Himani, I do have some resources I want to share
Mhm.
with folks, and I'll send them your way.
Okay.
And connect with me if you're curious and want to continue the conversation.
Yeah. Thank you so much for sharing all of this. I think we all need to like connect to you and get more on it. So thank you so much. To
Absolutely.
everyone who joined, thank you. Have a Great rest of your day. Before we wrap, I just want to say this is a community, not just a talk series. Feel free to reach out to us if there's anything we can ever help with. Thank you.
Thank you all. Bye.